Okay, inshallah, today we're gonna talk about general health maintenance and some chronic illnesses. Thank you very much for giving me the opportunity to be here, and hopefully some of us can benefit from this. I'm gonna share my slide here. Okay, inshallah, let's start. So we're gonna talk about well-being first. What is well-being? It's the state of being comfortable, healthy, or happy. I'm from Pakistan. When we were little, we'll say, and I'm sure people still say it over there. If somebody's a little overweight, you call them, yeah, they're healthy. I'm like, no, they're not healthy exactly. So the Prophet ﷺ was asked by his uncle Abbas. He asked him, what dua should I make? And the Prophet ﷺ, he responded that you should ask for afia. Allahumma inni as'aluka al-afia. And so there's different kinds of well-being. Afia is the word in Arabic for well-being. There can be worldly well-being. There can be spiritual well-being. We're going to talk about worldly well-being over here. I know we talk a lot about spiritual well-being otherwise, but we regularly make this dua in our morning and evening prayers, azkar as well. Allahumma afini fi badani. So we want well-being in our worldly life, and that means to remain safe in all the aspects and matters and affairs of life. Okay, inshallah. So what is well-being? There's different kinds of well-beings. Like I said, there can be emotional well-being, physical well-being, occupational, social, spiritual, intellectual, environmental, and financial. But we're going to talk about physical well-being here. Physical well-being is the ability to maintain a healthy quality of life by taking care of your body and making good habits, which includes exercise, sleep, eating healthy, rest, and simple things like washing hands, for example. And the main thing is understanding the needs of your body. Now, what does that mean? We are generally, when we don't have any ailments, we don't have any illnesses, and we feel pretty healthy otherwise, we still need to, at that time, take care of other things that are going to keep us in that state. And that includes all this, that we need to do regular exercise, we need to have a good sleep schedule, and eat healthy. And we're going to talk more about exercise later on. But let's say if someone has high blood pressure, and some people, believe me, they get devastated just because of that diagnosis. But that doesn't mean that you can't be feeling well. Of course you can be. You just have to do something different with your body, with your life right now. And so you have to understand what does my body need now, and that's what is going to help us in the long term. So physical well-being also is about caring for, respecting, and advocating for your body. Your body sometimes starts telling you, gives you signals, hey, this is not right. For example, you have a big smoothie, which is full of sugar. You're going to start feeling bad right after that. So you have to keep an eye into that, feel that, yeah, this is different, this is not how it's supposed to be. Or you have a whole, let's say, I'm from Pakistan, so I'm going to say a lot of things about Pakistan here. So you eat a whole naan with nihari and you feel really bloated after that. And you're like, okay, well, this is not right. So we have to keep an eye on those things that, hey, this is not working out for me. So I need to make some changes so that I don't feel this way. So this is your body's way of telling you something you're doing is not right for you, and you need to make some changes. So physical well-being is about that. So you wake up in the morning and you're feeling really tired and you're fatigued, and so you think about it, like, what's going on with my body? Why am I feeling this way? And you will be able to tell, hey, maybe I didn't get my 6 hours of sleep. Maybe I didn't, go to bed at the right time. Or maybe I was just with my phone the whole time in my bed, or I was watching TV in my bed. So I didn't get the rest that I needed. Similarly, stress, there's just so much stress around ourselves these days. Excuse me. You are constantly being bombarded with all these bad news from everywhere in the world. Your boss might be harassing you with more work every day, or if you're a student, you have more and more assignments every day. So there's just constant stress. So the stress goes around work life, your student life, even at home. The mothers who are at home, they have to meet so many needs of their kids. They're very demanding these days. So there's just too much stress. That has a negative impact on our body, but we're going to talk about it, inshallah. So how to improve your physical health. So I got these points from NIH website, and there's more on that. I know there's a lot of information out there, and sometimes we're like, where should we go? What should we do? So definitely you can look up on that. They have a toolkit for physical wellness. So the first thing is to get active. Why? Because sedentary behavior has been linked to many medical problems. Things like obesity, diabetes, those are the big ones. But other than that too, there's many illnesses that can be linked to sedentary behaviors. And most of us were sitting in front of computers all day. Or if we're not doing that, then we are sitting in front of the TV watching our favorite shows. And then so we go from one device to another device. So we're just sitting all day. And some people have actually labeled the chair as the new cigarette. So you need to get up from there. Like I'm sitting on a chair right now. You can invest in a standing desk. So wherever you can stand, you can do that. But otherwise, exercise. So the experts are recommending that adults should get at least 150 minutes of moderate physical activity a week. And we'll talk more about it, but this is moderate physical activity. Some people say, yeah, I walk around in my house a whole lot. Yeah, that counts, but this is consistent, persistent activity that increases your heart rate, makes you sweat, and you can tell when you're doing it. So we'll talk more about it. And then maintenance of your muscles. Now, there are certain exercises like resistance training that can actually help you build muscle. And this can help you continue to do the activities that you can do at a later stage in your life. For example, you like hiking, and you can start, at the age of 30 so that you can continue to the age of 70. I'm not saying that you cannot start at the age of 70, you can, but it will be harder. Now, if you had already built your muscle at an early age, it's just easier to continue. I'll give you an example. We went for Hajj last year. There was an elderly lady. She was probably close to 70. She had done Hajj a couple years before that on wheelchair. She then had bilateral, both knee replacements done. And she was ahead of all of us walking. You know how much we have to walk during Hajj. She was ahead of all of us, and the reason was that she was actually from a village, and they actually do a lot of walking, and they do a lot of physical activity. And if you think about it, myself included, my ancestors, they were all farmers. They were all doing very, very healthy lifestyles. They were eating their pratas and their desi ghis in the morning, but then they would get up and go work in the farms and walk there, do more physical activity. So they had a lot of muscle strength. And that helps, to continue. Now we moved from doing farming to sitting in front of computers and doing all our work in front of the computers. So what are we doing now? We have no muscle strength. Most of our muscle gets changed over to fat, and then that increases our risk for many different diseases. So what can you do? There are certain resistance training exercises. There's a lot of information on the internet. You can do push-ups, squats, lunges, core body exercises that all help with muscle strength. And again, some of us who are more avid exercise, they do a lot of, like, for example, the teenagers, they do a whole lot more. So invest into that. I think that's a great thing to do. Next is finding a healthy weight. So keeping your body at a healthy weight may help you lower your risk of heart disease, type 2 diabetes, and certain kinds of cancers that can result from carrying excess weight or obesity. So we see that, right? Some people are very, very conscious. They weigh themselves. They keep an eye on, if their clothes are fitting them or not. But others, they give up. Once they see the weight is slowly climbing up, they're like, okay, I can't do anything about it. They get very, very depressed about it, and then that's something that makes them more depressed, so they stop. But that's not right. We have to keep an eye on it, and find what's your healthy weight. We'll talk about BMI ahead, but that's something very important that we work towards that. Next is eating a healthy diet. Most of us think that, hey, I think my diet's pretty healthy. But we are in fact eating a lot of unhealthy foods. And even if we're not eating McDonald's every day, eating regular stuff at home is also can be very unhealthy. We have to keep an eye out for the saturated fats that we're eating and the starchy foods. We have to give up a lot of like starchy foods. For example, pasta. These kids, the kids these days, they love pasta. They make lasagna. There's more cheese on it, so that's super unhealthy. Think about pizza. How often do you eat pizza? A lot of kids, they eat pizza 3 to 4 times a week. And it's just not here in the US, it's everywhere. Even, in Southeast Asia, people are eating all these things. They have given up their healthy whole grain breads for more starchy kind of breads that are unhealthy for us. So we need to, start looking, start researching into that. What am I eating? There's a lot of stress about Mediterranean diet these days. The trends always change. These days, there's a lot of stress on Mediterranean diet. So you can look up that. There's Mediterranean diet books out there. There are recipes. And most of it is just whole grain and lean meats. And then lots and lots of fresh vegetables and legumes. So those are the things that we need to start paying more attention to. Diet is major in every illness, every prevention of every illness. You will see that every doctor is going to talk about diet, and we'll talk more about it. Next is metabolism. So metabolism doesn't stay the same. It does change as you get older. Around menopause, for example, our metabolism just goes down, and it's just related to all the hormonal changes that are going in our body. We're getting old. You burn fewer calories and you break down foods differently, and you also lose a lot of lean muscle. So what does that mean? You have to exercise more and you have to eat less. Otherwise, you're going to put on more weight and you're going to be facing more challenges. So you have to keep an eye out on your metabolism. And then generally just building healthy habits. We talked about sleep a little bit here. And then other than that, we just have to get more and more exercise. And then reduction of stress. We talked about that a little bit here. And also a lot of people don't realize how bad smoking is. There's studies out there that, smoking not only it causes all the diseases that we'll talk about, but it's really, really hard to give up. Some people actually said it's harder to give up nicotine than heroin. So first thing, don't smoke. Don't pick up the habit. And then it's hard to quit, but there's help out there. There's different medications that are available, and we have to use the resources that are available to us. Many times in our clinical practice, you'll see this is a question that we ask everybody: do you smoke? And if they say no, I don't, and then the next thing you ask is, well, when did you stop, or did you ever smoke? And then they'll say, yeah, I stopped like 2 years ago. And then the next question always is, well, why did you stop? And majority times it's either I got diagnosed with a health illness that opened my eyes, or one of my loved one did. So it's hard to do, but it's it's doable. Okay. All right. And again, as I said, The NIH website has a physical wellness toolkit, and you can look up more information there. All right, next point is, why should we exercise? There's numerous studies out there which show that unfit individuals are 2 to 3 times more likely to die during a few years follow-up as compared to more fit counterparts, regardless of their risk profiles, body habitus, or presence of cardiovascular disease. Now, what does that mean? For example, someone gets diagnosed with a heart disease, that they have a stent placed or something like that, and they're healthy overall. They've been exercises, they've been doing different kind of activities, they're not sedentary. If you follow them over a few years versus somebody who's more sedentary and they're not exercising and they're just being a couch potato, I don't know, whatever you want to call that, they're more likely to die, the ones who are not healthy and they're not fit. That's why actually after somebody who gets say a heart surgery like a cabbage, or even a stent placement, they are sent for cardiac rehab, for strengthening exercises and also for endurance exercises and resistance training, so that they can be healthy. So there's a lot of studies that have shown that, over time, people who are fit, even if they have medical illnesses, they can still do better as compared to those who don't exercise. Another thing is that whenever we're thinking about like a big disease, for example, heart disease, or we're looking at stroke, there are certain risk factors involved with that. Some of them are modifiable and some are not. For example, what your genetic makeup, you can't change your genetic makeup, but you can change your lifestyle. You can also, that means that you can exercise more. And then another thing is that you can give up smoking. Those are things that you can easily do. You can reduce your weight. So those are the modifiable risk factors. Now, somebody who already has hypertension, you can't change that. Then you need medications for that. So that's what it is, that physical inactivity is something that we can change, we can do something about. So we should do something about that. Next is that exercise is beneficial for all medical diseases and mental health. Actually, I know we've talked a lot about mental health in this webinar, but it is very, very beneficial. Many times you will have people who are coming into your clinic and they'll say, "Oh, doctor, I'm just so tired. There's something wrong with me." You do their tests, everything comes back normal. And our advice at that time is, you need to change your lifestyle. You need to start exercising more. You need to do something for yourself which will make you feel better. And that's the main thing, is exercise there. And then simple exercises like walking reduces weakness even in very old and frail adults. So if you look at people who have been very active in their earlier life, even when they're older, you still see them walking. I mean, you can look around, your grandparents, you can compare your uncles and aunties who were actually walking around doing things in their earlier life. They're still pretty active when they're older. And that has a huge benefit, versus people who get very frail and they get very weak. They are suffering more falls, breaking their hips. It's just terrible. So we need to invest now in our health. We need to do more for our body than anything. We have to remember that our body is really an amana from Allah subhanahu wa ta'ala, and we have to take care of it. It's the most important asset that we have. Our health is the most important asset. And you realize that once you lose it. I have been active most of my life. I've exercised, but I recently had a problem. I had a surgery in my back, and I was, I had to do bed rest for a week. And that just made me so weak, and it made me realize that, hey, if I wasn't active before, this would have been harder. I mean, I couldn't even walk from my bedroom to the kitchen. So, and 5 minutes of walk, that just tired me out. And I was thinking about people who are not active, who have issues from before. How are they going to cope with it once they get sick? Any kind of illness, you get admitted to a hospital, they tie you down to that bed, they don't let you get up. And there's fall risks and all that involved. So people, they get debilitated very, very quickly. And the only way to stop yourself from getting to that level is to just do, exercise, take care of your body. All right, so physical activity, we're going to talk about that. What is physical activity? Is any body movement that works around your muscles, and it requires more energy than resting. Walking, running, swimming, yoga, gardening, all of those are kinds of physical activities. But again, we have to remember our heart rate has to go up, and you have to feel that you're getting a little, having a little difficulty with breathing as compared to when you're just resting. And the more you do physical activity, the better these things get. For example, the marathon runners, for example, they have their heart rate running in the 30s all the time because their body is just so used to it. So these things, they get better with time. So there's different things out there when doctors talk about exercise. For example, weight-bearing exercise. You will hear this a lot. Weight-bearing exercise. Now, what does that really mean? It means that these are activities that involve your feet and your legs carrying your body weight while working against gravity. Now, they can be high impact or low impact. So high impact things are like, jumping rope, hiking, jogging, running, climbing stairs, tennis, etc. When you actually are, moving your body in a way that it gets up and down. And then low impact things like walking, treadmill walking, or cross-country ski machines, stair steps, rowing machines, water aerobics. So, and then, again, we talked about, lunges and squats and push-ups. All those are also included, and then weight training. So what are the practical steps, to incorporate more exercise in our lives? First thing we have to look at is, what are the hurdles? What are my hurdles? Why am I not exercising? And you will see majority of the people, they have excuses. I don't have time. I'm too tired. I have so many responsibilities. I can't leave my kids alone. Now, only you can, fix your problems. Only you can see what is going to work for me, and basically stop making excuses and do this for yourself. So you can start somewhere and just increase gradually. Nobody expects you to start doing a 45 minutes walk right away. You can start slow. For example, you can divide your walk several times a day, 10 minutes in the morning. You can do 10 minutes before lunch or even after dinner. This is easier to do, and it actually does help you get your mind off certain things, and helps you with stress as well. You can exercise on weekends. Remember, we talked about 150 minutes per week. So that means that you can do 70. If you do 75 minutes walk on Saturday and 75 minutes walk on Sunday, that has the same benefit if you do that divided 150 minutes a week, in, like, say 5 days a week, you do 30 minutes. So this is doable. Most of us, we have time on weekends, besides doing everything else that we have to do, we can incorporate some exercise on the weekends. And again, it's the same benefit if you increase the same intensity in half the time. For example, you walk for 30 minutes or you jog for 15 minutes. It has the same benefit. So that's useful to know. You can find a partner. It really helps. Whether it's your spouse or you have a friend or you have a walk buddy or a gym partner, somebody. If someone is there, it helps with accountability. It helps with planning, and it is usually very beneficial. These days, there are so many apps, or there's the fitness devices that we can use. I use something called as Forest. It's very good. We all know about the 10,000 steps. It does come out to be 4 miles a day or something like that. You can set where you want to be. It really is useful because our minds work this way. When we see, hey, I accomplished this much today, it actually gives you positive feedback, and you will like to continue that then. And again, you can join a gym or join a fitness program or a fitness coach. All those are beneficial things because if you invest into something, if you've paid money for something, the chances are that you will go for that. So, I think that's beneficial. All right. Now we're going to talk about routine physicals. This is under preventative health or general health maintenance. why should we go for a physical? You know, you hear people saying, hey, I don't have any problems, I feel fine, why do I need labs? It's all after, you know, it has been studied a lot, and all these recommendations are coming after studies. So they're not coming from just nowhere. You should be seeing your PCP annually for physicals, for preventative care. There's an old saying, prevention is better than cure, which is absolutely true, especially in our field. There is an organization called as USPS Preventative Task Force. It has a lot of independent panels of experts in primary care and prevention. They give a lot of recommendations based on evidence. And most of the tests that when you go in for your physicals, your doctor is ordering based on that. So it's not just out of nowhere. So there's preventative care actually helps you detect health problems way earlier than before they become serious. There, you know, the USPS task force regularly release recommendations. Sometimes they do change. So, you know, we don't have to say, okay, yeah, you know, this is what it was. They do change sometimes. And some doctors, they actually follow the specialty guidelines. For example, the cardiologists, they follow AHA guidelines, or similarly, the gynecologists follow their own OBGYN guidelines. But end of the day, it's all helps to give us the preventative care. So let's go to routine. So what happens on a routine physical? You walk in and the nurse will see you first. She will do some vitals for you. They will check your heart rate. They'll check your blood pressure, your temperature, and your respiratory rate. So those are called as vital signs. And then they will check your weight and your height, and they calculate your BMI, body mass index. We'll talk a little bit. There's a formula that helps you figure out where you exactly fall. We'll talk more about it later. And then there's usually a questionnaire on mental health. This is a depression screening that is also done when you are going for a physical. The doctor will then perform a physical exam for you. They will listen to your heart, you know, feel your belly, do a skin check. And then, you know, for the females, there'll be a pelvic exam and breast exam and all that. Then the doctor is going to order some labs for you. Now, what does those labs include? There's a whole variety of labs that are done for preventative care. Starts off with the complete blood count that has your hemoglobin, your white blood cell count, your platelets. You do find a lot of times, you know, people are anemic, they never knew about it, or they have a low white blood cell count or low platelet count. Sometimes, believe it or not, people get diagnosed with cancers, you know, which are, you know, blood cancers just based on doing that CBC. So it's important. And then you have electrolytes, which include sodium chloride, there's bicarb, there's potassium levels, and you do see some problems with that just with routine labs. And you check kidney function, liver function tests. Again, those are important. Sometimes you see liver function tests being elevated, and then you find out that, yeah, I mean, the patient has hepatitis, they just never knew about it, or they have chronic kidney disease, but they were asymptomatic, so they never found out about it. And the next big thing is the cholesterol. That gets checked, and we'll talk more about it later. And then the thyroid tests, those are the routine labs that most doctors do. In some cases, they will also order a vitamin D level for you. Recently there has been a lot of stress on checking vitamin D. Your insurance sometimes does not cover it, but you know, it's an important thing to do. And then the hemoglobin A1C, which is a 3 months blood sugar control. If you had problems with the elevated blood sugars in the past, your doctor will order it. And then, you know, again, there's another test that unless there's a need, sometimes insurance doesn't cover, but it's a very useful test to do. And then, you know, part of the routine physicals is also doing a sexually transmitted disease testing wherever it is needed. So then those are the main blood tests that are done. And other than that, during your routine physicals, you will also have certain cancer screenings. And these are based on USPS task force recommendations. So skin cancer, there are at least 3 kinds that, you know, you can, with the basal cell cancer, the squamous cell, and melanomas. Sometimes you have these moles on your on your skin, and then they start changing, your PCP can pick up on those, and they can refer you to a dermatologist. Sometimes you need biopsies on those. So those are the things that they do check for at your physical. Lung cancer screening, that is primarily for smokers over the age of 50 who have smoked for 30 years, 1 pack per day. There's a screening CAT scan that is done yearly, but that starts at the age of 50, and there's very specific criteria for that, but that's done. Breast cancer screening is done by a clinical exam, and also with the mammograms. Mammograms are usually ordered yearly after the age of 40, and according to some guidelines, it's every 3 years, depending on what your PCP is following. Many women get diagnosed through mammograms. We cannot stress enough on the importance of these things. And then there's the cervical cancer screening for women through a Pap test. And that's done also. Most places it's 3 years, and some gynecologists, they do it yearly. There's prostate cancer for men. That is usually done by a PSA. That's a little controversial. But I've seen most PCPs still ordering it. It's just a lot of more testing that comes after a PSA being elevated, because it can be false positive, and then many people end up needing a biopsy, and there's more problems with that. So that's a little controversial, but it is done as well above the age of 50. And the most important, again, is colon cancer. That includes a colonoscopy. It was recommended previously, a few years ago, it was above the age of 50. Now they have actually reduced the age down to 45. And that's because of increasing incidence of colon cancer in our society here. And people who are not willing to do a colonoscopy, then usually another test called as Cologuard is done, which is usually they send you a kit at home, and then you put a little poop specimen on it, and then they can check for some stuff there. But gold standard is colonoscopy above the age of 45 now. Then there is the abdominal aortic aneurysm screening above the age of 65, and that's usually for smokers. And screening for osteoporosis, which is weak bones, above the age of 65 in women. These are the preventative things that are usually done. And then based on your risk factors and what your family history is, your doctor might ask for other things as well. So it's just, there's a whole wide variety of things that you can get out of a physical. So it's not really nothing. It's very important to get a physical, and it starts at an early age. I know we're very careful about bringing our kids for physical, but as we get older, we just feel fine. So you're like, why should I go for a physical? But as you can tell with all the stuff that I told you about right now, that it is very important. Many things get diagnosed on just routine physicals. And then, if you act on it early enough, that's very beneficial for yourself. Next is immunizations, routine flu vaccines every year, and then shingles is above the age of 50 for everybody. Pneumonia is above the age of 65, unless you have risk factors, then it's done early. Tetanus is every 10 years, and then meningitis is usually given for college students. All right. I know we talked about routine physicals a little bit. I want to quickly touch base on a few illnesses which are very common, and they have a huge impact on chronic illnesses. And then the reason why I picked up a few here is because these are the ones that lifestyle modifications is really going to help us. So first is hypertension or high blood pressure. Everybody knows about it. Usually you start having warning signs if it is above 130 over 85, but it's treated if, excuse me. It's usually treated as above 140 over 90, but you have to confirm that in 2 separate checks. And you have to have nothing else going on at that time. For example, if you have a headache or you have abdominal pain or vomiting, your blood pressure is going to be high. So it's asymptomatic, means that most people don't know that they have hypertension. But in the long run, it can lead to heart disease, strokes, kidney disease, primarily through atherosclerosis, which is the deposition of plaque in your blood vessels. And the blood vessels then become very thickened, and this happens over time. Most people with when they are first diagnosed with hypertension, the first thing is always is to tell them to do dietary changes. DASH diet is what usually is recommended for hypertension. And you'll tell people, okay, go ahead and start doing some exercises and try to lose some weight if that's possible. You can see 10 to 20% improvement in some studies in your blood pressure, but majority times you have to resort to giving blood pressure medications. And the common ones are beta blockers, and that you might have heard about these medications named metoprolol or carvedilol. Then there's the ACE inhibitors, which is lisinopril or enalapril. There is the ARBs, which are called as losartan and valsartan. And then calcium channel blockers. Most of us have heard about amlodipine or Norvasc. It is the most often prescribed. And some people are given diuretics like hydrochlorothiazide. A lot of these medications, you need blood testing to monitor the levels. And this is very well tolerated, and usually people don't have any side effects from it. So you get diagnosed with hypertension. This is not something devastating. It's going to be all right. But again, first thing is always dietary changes, exercise, and weight loss. Next is diabetes mellitus. So we all know about it. I don't think this is news to anybody, but this is a problem with regulation of blood sugars. So what are some of the symptoms? That you will have excessive urination, you'll feel very thirsty or more hungry, and then, weight loss. You just lose nothing has changed in your life, and you're losing weight unexpectedly. Majority times it's uncontrolled diabetes. You go check your hemoglobin A1C will be above 12. And then some people will, believe it or not, they will come in because they are having yeast infections or fungal infections, and then you do their blood test and you'll find out that they're diabetic. Now, if they had gone for a physical, their doctor would have done some blood tests and they would have known already. So it didn't get that far. I have had patients, they came in with fungal infections in their ears, going to their brain, and they're, really, really sick just because they had uncontrolled diabetes. Now, there's two kinds. Most people know this already, but type 1 diabetes is actually an autoimmune disorder. When the pancreas, it does not produce insulin, it just stops. And then in this case, you have to do insulin injections from the outside. And this is very dangerous because it can kill people with diabetic ketoacidosis. Usually it happens in thinner patients who are younger in age. And then type 2 diabetes. This is more common, and usually it is related to insulin resistance. What that means is that your body is actually producing a whole lot of insulin. Usually it is produced in the pancreas. Your pancreas is, working really hard producing all this insulin, but the receptors, the insulin receptors, which actually help regulate the blood sugars, it's just not taking it. So the pancreas is producing a whole lot more, but it's just not working. So what do we have to do in that case? First thing, dietary control, lifestyle modifications, weight loss, exercise. And then most people, they start on medications. We usually don't start until the blood sugars are above 126 fasting, and then 180 non-fasting, and then hemoglobin A1C above 7. So you start off with the first one is always metformin in every case. As long as your kidney function is normal, you will be started on metformin, and it's a great medication, very well tolerated. Initially people have bloating, but later on you're fine. And then recently there's been new medications which have revolutionized diabetes care. And these are the GLP-1 agonists called as Ozempic. Those are the shots that you see, on TV commercials. They are once a week shot under your skin, and they are amazing medications. I think they're a godsend. And then the other ones are SGLT2 inhibitors called as Jardiance, or for some people are Farxiga. They have cardiovascular protective benefits, and then those are usually prescribed for people who have heart disease as well, but otherwise too, they are very useful medications. Again, the point is that if you get diagnosed early, it's great. You can do lifestyle modifications. If that doesn't work, you go to medication. If that doesn't work, if the metformin doesn't work, there's plenty of other medications. Most of the time, If it's uncontrolled diabetes, for a long time in type 2 diabetes, they end up on insulin, but much later in life. Diabetes, if it doesn't, it's not controlled over time, leads to heart disease, leads to strokes, leads to kidney disease, and multiple other problems. So this is the mother of diseases. Next is metabolic syndrome. Now, this is a group of conditions that increases the risk of heart disease, diabetes, stroke, and other health problems. It's diagnosed when someone has at least 3 of the following risk factors. And actually, when I read these out to you, most of us are going to say, hey, I have that. So, men who have waist circumference of 40 inches and 35 inches for women, and then blood triglycerides levels of 150. HDL cholesterol is less than 40, and then the blood pressure of 130 or 85, and fasting blood sugar greater than 100. A lot of us have this, so, but what does it mean? It means that we need to take care of ourselves. We just have to do a lot of lifestyle modifications, dietary changes, mainstay. Again and again, all these issues, they're big issues, but we can do something about it. Next is obesity. It's a complex disease. It involving having too much fat, too much body fat. It's not just cosmetic that, you say, hey, I'm getting too big, and then how am I looking and all that, but it actually it's a medical problem. It has problems causing other health issues, including heart disease, diabetes, high blood pressure, cholesterol, liver disease, sleep apnea. Sleep apnea is very common when you see, they can't sleep at night because the minute they sleep, they start snoring, their airway closes, and it becomes a huge problem. And even some kind of cancers are also associated with obesity. So there's multiple risk factors for obesity. We don't, can't even tell, but there's so many. But the first step, whenever you're diagnosed with, again, it's the first step is lifestyle modifications always. There is now medications, mostly the same Ozempic that I was telling you about that we treat diabetes with. That's being used these days for obesity, and then eventually people who get above a certain level, they need bariatric surgery like sleeve gastrectomy. So this is, if you look at it, BMI is a calculation between your weight and height and your gender, and then below 18.5, people are underweight. Between 18.5 to 24.9, you're healthy. So you see that there's a very, very tight thing here when they call you healthy here, and then above between 25 to 29, you're basically overweight, and above 30, you're obese. BMI has its limitations. It's not something that I would totally rely on things, but it gives us a good, at least a marker about where we're at. But for obesity, if people are above 30 BMI, then medications are prescribed. Between 25 and 29, you still talk about weight loss modifications, but once you're above 30, then medications are prescribed. And then they're usually, if you see somebody who was kind of overweight and all of a sudden they've lost weight, chances are that they're taking Ozempic, because it's really beneficial. It's been widely used these days, and most insurances also cover it. So it's being used for that. But once you are above BMI of 40, we kind of lost hope. At that point, surgery is recommended if you have some kind of comorbid conditions associated with it, which includes diabetes or hypertension and things like that. Again, hyperlipidemia, another modifiable risk factor that we have. What does that mean? High cholesterol. So when we do a cholesterol check in your body, in your blood, there is the LDL cholesterol. They taught us years ago, LDL is the lousy cholesterol, HDL is the happy cholesterol. So basically HDL needs to be higher, LDL needs to be lower, and then the triglycerides, that's the fatty stuff in your blood. And this is above, if the triglycerides above 600, you get started on medication called as fenofibrates. This is actually very dangerous. People who have triglycerides about 1,000 or 1,200, they come in very sick sometimes with acute pancreatitis, and that can actually kill people. So it's important to do this lipid panel in your physical. LDL cholesterol is usually the one that is followed for starting medications. Most diseases like heart disease or stroke, you want the LDL cholesterol less than 70. And then HDL cholesterol should be above 40. A lot of, like, if we talk about metabolic syndrome, people have HDL less than 40, and exercise helps with that. And then healthy fats like, avocado and all that, that would help with it. But that's a longer discussion. Mainstay of therapy in hyperlipidemia, again, is lifestyle modification. In 2013, the guidelines changed. Now we don't prescribe statin medications called as atorvastatin and rosuvastatin for everybody who has LDL above 130. Before that, that's what very frequently prescribed. People would have a lot of side effects. Now you have to keep in mind about what their risk factors are, like if they have hypertension, if they have stroke, if they have some like heart disease, then you give them the statin medications. But other than that, first thing, lose weight and exercise. So here are my take-home points. We have to invest now for the future. We have to take care of our body. It's an amana. We don't own it. Allah subhanahu wa ta'ala owns it. He gave it to us. The most important asset for us is our health, and we have to take care of our health. And so improving your diet, increasing exercise, sleeping adequately, and reduction of stress is going to help. Give up smoking. And one more thing that has been increasingly seen in a lot of studies for healthy people is that people who have good relationships with their friends and families, they tend to live longer and they tend to live healthier. So that's what I got. I'm gonna get out of this, and then we can see what other points that we have. All right. So,
thank you, Kiran. There's a question. Somebody raised a hand. I don't know if you can let some people talk.
yeah, I'm trying to get to that. Sorry, I think I have to stop share first. Okay. Okay.
Can you let people talk? Because somebody put their hand up and they have a question.
Sorry, but I don't know. How do I change that? Can I make you the host, or no? I think
you could make me a host, I guess. But the other question I had for you is, I can't think about any South Asian film as not having the opportunity. Like, everybody who's South Asian has a waist circumference of 35 and above with metabolic syndrome. So how do you really work that, or how do you?
Right.
How would you say, what would be your thing for? I mean, I think I have weight circumference about 35, but my blood sugars are fine, and my fasting glucose is diabetes. I mean, I don't have diabetes, but a strong family history. So I'm curious what your suggestion would be. I'm trying to do my exercise, but I guess eating is the biggest problem for me.
Yeah, I think again, it's also lifestyle modifications and exercise. I guess maybe talking to a gym instructor might help. But core exercises are good for losing body, abdominal fat. That's something usually helps. But over time, we just have to be consistent with what we're doing. Total, if you continue to lose weight, eventually that weight will go away too. But that's the hardest to lose, is first to put on and last to go away. So just
right. I
just
mean,
have to keep
consistency
working
is
on
a
that.
big thing. Sometimes you do things and then you lose. I did open up Nemo for you to talk. I know you raised your hand.
Yeah, I think, can we unmute them, or they can unmute themselves, or?
I did ask them to unmute. You can always type the question if you have a question
Yeah,
in the.
I'm sorry, I just don't know how to unmute.
No, I got myself made the host now, so.
Okay.
Yeah, you can, if if you have a question, you raise your hand here. Oh, there you go. Is it in the question and answer? Yeah, I said kindly guide why you need test and after how many days when taking blood pressure medicine.
Okay, yeah, sure. So basically, we talked about the different medications in the use of as hypertensives. For example, we take the lisinopril, for example, or that's an ACE inhibitor, or we have the hydrochlorothiazide, which is a diuretic. So you have to keep an eye on the potassium levels because lisinopril is going to increase your potassium level. ARBs or ARBs, they're similarly going to increase your potassium levels, and they can also have an impact on the kidneys. So you have to make sure that your kidneys are still working well and it's not having a negative impact on it. So that's why you need with ARBs, mostly ARBs and ACE inhibitors and the diuretics. Those are the hydrochlorothiazide. Those are the ones that you need. Blood tests. Usually what I do in my clinic is that I put somebody, first you have routine blood tests and make sure that their potassium is not already on the high side. But if it is, because if it is, then that's not the first thing you're going to start there. Similarly, if people who have kidney problems, you're not going to start with that. But overall, after sometimes to make sure that their kidneys are stable, that's actually the medication to give them so that their kidneys does remain stable. But then after like in a clinic setting, I would see a patient. If the blood pressure is high, I'll put them on, a lisinopril to start off. It's a cheap medicine. It's very well tolerated. And then about a month later, I'll tell them, hey, please do this basic metabolic panel, which has electrolytes and kidney function. And then we can continue the medicine, but at least we can make sure that their labs are fine.
So how often do you take the test?
So it's every 6 months or so, and then once you've made sure that they're gonna stay okay on it, then you can just do your routine test once a year when you see your provider for a refill. And that's why you see sometimes when you're up for a refill and your provider says, no, you need to see me, you need to do some blood tests before I can refill it. So to clarify, after a month of starting, and then 6 months, and then once a year.
Great, thank you. Anybody else had a question? Anything to add? Awesome. No. Jazakallah, Kiran. Thank you very much. That's very helpful because I think it's that quick reminders and taking care of our health. So important. Simple things, consistency. So Jazakallah for your time. Thank you for all that information.
I hope that at least if one person benefits from it, then the
know,
aim is.
Alhamdulillah, and this is it. We do a lot of these recordings and the recording goes on and a lot of people get back on it. We have about 200 to 300 views on these YouTube recordings. So it's helpful for us to do this because even if one person finds it helpful, this is good.
Inshallah. Okay. Jazakallah khair for letting me do this.
Yes, no, alhamdulillah. We're going to end the meeting here. And then, yeah. Anybody else have any question or anything? Okay. Wait a minute. Okay, yeah. Thank you. Yeah. Jazakallah.